Who packs their hospital bags at 38 weeks? I'm always packing my hospital bag very, very late. Please, that's a very bad practice. I will preach that, and then the next year that I'm pregnant, I'll still do it again. It's very wrong because a lot of people must have given birth at this time. Some people give birth when they are 35 weeks, 37, 36. Some even way earlier than that. So packing your hospital bag as late as 38 weeks is very, very wrong. By 30 weeks, 29, 28, 29, 30 weeks, your bag should be ready so that in case of any emergency, you are ready. Don't be like me. My babies don't normally come early. My earliest baby was 30 weeks. My first child came at 40 weeks and 1 day. The third one came at 39 weeks and 2 days. So now here I am 38 weeks and I'm not in labor. So mine happened like that. That might not be your case. So don't say because I like that woman on Instagram and YouTube and she packed the bag at 38 weeks, it's not right. So I have my list here. That's why I have this. I have a list here so that I will not be everywhere. And then this is my gadget. Please don't mind the noise. I have 3 children, so my children are crying. I'm sure they are fighting for something. That's why you can hear the noise. So this is my hospital bag that I'm packing, and I'll sit down now so that we can discuss all that is happening here. Okay, so normally when you are going for antenatal, they will tell you what and what you're supposed to pack in your hospital bag. Some hospitals give you hospital lists. They will just have a list of the things that you will need in your labor and delivery room, either in the theater for those that will be going for CS, and then other things that you will need in the postpartum/recovery room. And then some hospitals will tell you that they sell the delivery pack, so you can get from them or you can get from outside. Some hospitals don't even give you an option. You have to buy from them. And then some hospitals don't even tell you anything at all, so you are confused. So I'm currently doing my antenatal with National Hospital, Abuja, Nigeria. So they have a delivery pack, and this is the delivery pack. This is our delivery pack. On it, National Hospital Abuja delivery pack. So it depends on the hospital you might be going to. Some people don't even package it like this. They don't write the names on it. So if you are going into labor, if you want to go and deliver, you are going to have 2 different types of bags. It might not really be bag, but 2 different types of packings. So the first thing you are going to pack is what you take to the labor ward or to the theater. It depends on whichever method they are going to deliver. So this delivery pack contains the things that they will need as you are giving birth. They are not going to take your whole bag because they don't need that. So what is in this delivery pack is 2 packs of underlay Nightingale. What I'm so sorry I would have bought for people that don't know it, but you can Google it. You can see Nightingale. They call it underlay. They put it on the bed. It's more like a Macintosh, but this is disposable like diapers. So they put it on your bed to prevent you sawing the bed, the delivery bed, or your own bed when you go to the recovery room. So 2 packs are here. They are using them strictly for you. Then we have 4 packs of surgical gloves. Surgical gloves are the ones they will wear before. They are more thicker and then they are wet. They are not dry like the normal gloves. So they will wear that one to take your delivery or to do your CS cesarean section, the operation for removing the baby. And then you have normal gloves where they can wear and then give you injection, do other things to you, give you medication. So it is here. Then you have cord clamp. There's cord clamp here, what you see on baby's navel, like peg. That thing you see on your baby's navel like a peg, cord clamp, is also here. Now then there is a new umbilical cord gel that they use these days. It's called Cloxy G gel. You apply it on your baby's body. It's inside here, so I can't remove it. You are not meant to open this, so that they will not say, oh, all the things they gave you are not here. Ideally they are supposed to put everything here before they will say to you, but they said there was no jig inside. Before, we didn't used to provide these ones, but this is a new method. So you provide jig extra, and then they said we should provide olive oil ourselves. So I have my olive oil here. This is Goya extra virgin olive oil. You can buy the plastic one, you can buy this one. So before, they will use it with a big cotton wool, a bigger size, and dry the baby's skin. But these days they use any of the delivery pads. This one is Daily Pad. We have Dr. Brown, we have Lady Seb, just different brands. So 2 packs are here. So when they take you to the delivery room and the baby comes out, or to the theater, they use 1 pack with olive oil to dry the baby's skin, and then they keep one pack for you to be wearing. So 2 packs are here, and I bought 2 extra packs for myself. So when you go to labor and delivery, this is the only thing you are going to enter the labor ward with. And then you have, they will request for your baby for you to give them 1 blanket or flannel or shawl. I don't want to open this one, but I'll open this one here for you. It is as big as a wrapper. If you are in Nigeria, you know what I mean. You can put a baby inside. So I have one here. Why I don't take so much thick things is I don't feel comfortable in giving a whole shower for a baby or blanket because of our Nigerian weather. Even though now it's August, it's rainy season, but we have times where the weather is really hot. So you can provide a shower, a blanket, whatever is comfortable for you, but this is what I'm providing. And then they will ask for 1 cap. This is what is happening in the delivery or in the theater when the baby is about to come out. 1 baby cap. This is my cap for newborn. And then they will ask for 1 diapers. You're not going to carry a whole pack of diaper in the delivery room, just 1. But this is what they need immediately the baby comes out. And then you provide 1 onesie. Baby will wear this inside immediately after the diapers. And then baby will wear 1 overall outside, and then mittens. These are hand gloves for newborn babies. So these are the only things, the only baby items, clothes that will follow you to the labor and delivery or the theater, because they don't need the other bag in there. This is the only thing they'll be making use of. So that's why I packaged these ones here. And then I have a nylon that will contain everything that is here, so I don't forget anything or make a mistake. I don't want them to be in a bag so that it will not be bulky. Like in National Hospital, they don't even want you to bring a bag. They'll tell you to put in a nylon so that it will not be bulky. And then you put here, you put, and then you put this one, and then you're supposed to take 2 wrappers, because you don't, in Nigerian hospitals, you don't labor in, or let me say government hospitals, because I've never been to a tush private hospital in Nigeria, so I don't know. But in government hospitals, you don't labor in gown or hospital gown, you labor in your wrapper. So you carry 2 wrappers, they will accompany you in this delivery pack, labor ward pack. they will come, because this, once you get to the room and they discover that, in short, before they check you, they say you should remove your clothes, remove your bra, remove your pants, tie one of your wrappers and lie down. They will remove your underlay, what I was showing you, put on the delivery bed and say you should lie down. They will examine you, put their hand in your vagina to check your cervix, how dilated is it, if you are actually in labor or not. And that is what you will labor in until you deliver. So by the time you deliver, one of these will be soiled, so you need to have extra. So having said all that, for this baby, I'm not going to be doing a vaginal delivery like my other 3 babies. I'm going to be going for an elective CS, which means that I have chosen myself to deliver through CS. It's not an emergency. Like emergencies, sometimes it's like maybe you have been laboring for so long and you are tired, or baby is tired, or you already have complications, so they are going to do emergency CS for you. But this one, I chose, myself and my husband discussed, and we decided that no, this particular baby will bring this baby out through cesarean section. So because of that, I'm going to go with 3 wrappers, but these wrappers are not going in my delivery pack because they're coming to take you from the ward. So they will give you a theater gown, so you don't need a wrapper, because I am not going to the labor ward, I am going to the theater. So this will go in recovery bag. So this is my bag that I'm going to pack my things that I'll go to the ward with after they will remove the baby. So the wrappers will be here. I'll need this thing because sometimes they say when they after the CS you'll be cold, so they'll give you one of the wrappers you cover, and you need more wrappers. So having said all that, you are supposed to have at least 20 pieces of diapers. So I bought the medium pack of size 2 Morphix diapers. You can use any diapers that you are comfortable with. This is what I love, and this is what I've been using for all my children. Initially I used to use size 1 for my babies for at least 1 week, because I love it when the diaper is fitting the child. I don't like it when the diaper is wearing the child, not the child wearing the diaper. But my children are always 3 kg. Even the one that was not to 3 kg was 2.7. So this will still enter. So this is 40 pieces of diapers. So I believe that this can serve before I come back home and then start using the rest. Even if it doesn't, my husband can always bring more for me. I don't want to carry a big pack of diapers to the hospital. So I have my diapers here. And then another thing on our list is your baby wipes. You can use water wipes, Huggies water wipes, or any other one that you are comfortable with. I used to use those, but these days I don't know why everything is so scarce. You can't even find a lot of things. Another thing we have on our list is our Dr. Brown's pad, but I've already told you that I have in my delivery pack, and I have 2 extra here for myself, so that I don't run out of, because the one that they gave me in the hospital is just 2 pack, and they are going to use a whole pack to clean the baby. Even if it's not all, they will use almost all. So I bought 2 extra, and then disposable nylon, the big ones that will put our garbage inside and trash. So that is used to put your placenta inside, and they will give it to you to go and bury for yourself. But I don't have it here, but you're supposed to provide that. I don't know whether all hospitals do that, but National Hospital is a policy that you bring to. And then this, you're supposed to have disposable pants, because most times when you deliver, it's easier to wear disposable pants so that you'll not be washing. Me, I bought plenty. I think there's another pack, because I'll be staying in the hospital, so more than a vaginal delivery. Because vaginal delivery for my first child, I delivered on Monday very early, and I came home on Wednesday. But the rest I used to go home on that day. But this one I'll be staying for at least 3 to 5 days maximum. So I don't want to be washing pants. As a matter of fact, I'm thinking of to even dry pants in the hospital. So I bought 4 packs. I think one is somewhere. This is a pack of 6 disposable pants. So if I have 4, that's enough for me to use and then dispose them till I'm able to come home. And then you have we have baby caps. You're supposed to have like 2 to 3. So since I have one in my labor and delivery pack, I have 2 here. My husband chose this. He really loved these caps. So I have 2 more here for baby. Then you're supposed to have baby towel. I have a very white towel. Oh, I'm afraid of white towels. This is my baby towel. And then I'm supposed to have blankets, flannels to put baby inside. Because I'm going to stay for quite some time. I have this for baby, and I have one extra flannel for baby as well. And then one extra flannel. And then you're supposed to have socks. I think I packed I packed 3 pairs of socks, but normally I don't use socks because I'm always wearing my children overall. So I'm just carrying this, and then face towel. If you check my video, my hospital bag that I packed, I will link that video down. It's one of my most watched videos in 2020. All these were not inside, but this is inside now because they said when you have a CS, a cesarean section, most times, in short, you're not supposed to stand up for at least 12 hours. You're supposed to lie down straight. That's what they told me before CS mama. So say me I stood up 2 hours after my CS. That's not what they told me. This is the one I heard from my doctor's mouth that I'm saying. You're not supposed to stand up for at least 12 hours. So sometimes you will not be able to feed. So someone might help you to give baby milk. I wanted to buy now, but I've not bought. So I packed this so that baby will not spill milk. And then I have apron, a little apron for the baby in case baby needs milk. And then you're supposed to pack a few other clothes apart from what you gave in the labor and delivery ward. So I have about 4 overalls and about 4 onesies, the ones that you wear inside. So that is what is inside this net bag here, so that I don't mix them anyhow. And then I have my spirits, Moco isopropyl alcohol. The spirit, you use this with this cotton wool. You just take a little of the cotton wool, then you pour the spirit, and then you clean baby's navel, so that every 2 hours you do that. Every 2 hours, whether baby is sleeping or not, it dries out the baby's cord, thins out, prevent infection, and then it falls off, because falling off early is very good. And then I have hand sanitizer, because anybody that is supposed to touch your baby, including you, the mother, is supposed to use hand sanitizer. Even the doctors, the pediatricians, they are supposed to use hand sanitizer before they touch your baby. So it's very good for you to have this. And then I have cup and spoon for my baby, in case they are supposed to. There are some hospitals, like Metama Hospital, they will not allow you to give baby bottle. They say you are discouraging breastfeeding. So they say you should use cup and spoon, or you should use syringe to give baby milk, so that baby will not be used to bottle. So that's why I have cup and spoon here, so that baby will be used to breast milk and not be used to the bottle. So I now have a bottle here, anti-colic, so that you know when babies are sucking on bottles, normally they are sucking air, and those are the things that cause bubble in the stomach, and they are crying in the night, in the afternoon, that we are giving drip water, we are giving, and the rest. So this is anti-colic baby bottle. This one, as they are sucking on it, is preventing air from entering their stomach. So it's very, very safe for newborn. So I just got this in case I need it, let my baby not suffer. But my breast milk is already coming out, my colostrum is already coming out, so I know we will not suffer as soon as I can be on my feet. But that notwithstanding, I got it. And then I have my breast pad just to put on my breast because I normally have plenty milk. So this is fine. These are not disposable. I don't like disposable because they are very expensive, and then once you wear it you throw them away. But this once you recycle, you wash them. These qualities are not good again. Before I used to have very nice quality. So this is like 1, 2, 3. This is, you use this ones 3 times for here, for here, for here. So even if you don't wash this one, you can use this one, then you wash all of them again. You can even wash them in your washing machine, but they are small, so you don't have to be a lazy mama. You can wash it yourself. So I'll buy more, but for now this is what I have. And then I have Jimbo Ori for my baby. Initially I used to use palm kernel oil, but I've graduated to Jimbo Ori these days. Even the big ones, this one say early age, so you can use for newborn, you can use for adult babies. And then I have baby mycotin for baby butt to prevent rashes. I use baby tributan, but I've been looking for it, I couldn't find. So I say instead of me to go to the hospital without anything, then I get baby mycotin. And then I have my baby sponge to bath baby. I have Agnesia soap to bath baby. People use different soaps, Boots, Aveeno, they have all good brands, so it depends on what you want. So it's not like you see somebody using something and then you are bashing the person. No, this is what I use for my babies, even the big ones. And then I have rub. A lot of people say, oh, rub is not good for newborn. I use rub for all my children. When I bath them as they are tender, I rub on their ribs and all that. So this is my rub. I don't even use those mild ones. I use this one, the African babies. Then I have Dettol. Oh my goodness, Dettol is so expensive. I bought Dettol for babies water, at least in the hospital. Then when we come back home, we will get more. This cotton wool is here for cleaning of baby navel and then cleaning of my nipple before baby comes, to clean the dead skin on my breast, so that my milk, immediately I cleaned it, my milk came in, it started coming in. So you have to clean your breast when you are pregnant. I use coconut oil, this with coconut oil. Some people use water. You can use rose water, you can use olive oil. So I have my brush and toothpaste here. I bought a small toothpaste because I won't be needing so much. I have my sponge and my soap. This is my soap, Ashanti Papaya. This is my soap, this is my sponge. I have my shear spray, because they say when they do you CS, no more bathing. You are not going to take your bath like again. They will only rub you. So I don't want to be smelling anybody. Yes, I need to use the toilet. I would have said, Father, may I not use the toilet, but how is that going to be possible? So I have my sorry, to control the infection. I don't want any nosocomial infections that you don't carry from your home, you want to carry in the hospital. And this is my cream. Oh please, this is my anointing oil. I don't rub cream when I'm pregnant, everything smells so bad. So I use my anointing oil as a protection and as my oil. So that's why there's no cream here. And then I have blue sea Vaseline. Blue sea Vaseline is used for different things. Some people use it for diaper rashes, to prevent diaper rashes. Some rub on their children, but that's not why I use it. I use it for my baby cord, but let's not go into that. You can use anything that you want. And then I have my own towel. I showed you my baby's towel. This is my own. I want something very light so that it will not be smelling refusing to dry in the hospital. So that's my own towel, even though I might not need it for so long. That's where they bath the clean body. And then after having all the disposable pants, I have about 4 pairs of real pants, cotton pants here, which I might not wear, but instead of having regrets, I still carried it. I have my Bible. This is a very fancy Bible. My husband bought it for me, so I'm going to carry it, taking it to the hospital. Then I have my book here. I want to be working. Once I can be able to sit up, let me start working on Fertilemoms Coaching School. I'm working on Fertilemoms Coaching School for those who want to become fertility coaches like me. If you are watching me for the first time, my name is Blessing Sule, aka the Fertile Mom. I'm a health coach, fertility nutritionist. I'm a student midwife, a vaginal steam facilitator. I'm a herbalist. I help couples who are trying to conceive naturally through lifestyle changes and adjustments, supplements, multivitamins that increase their chances of conception to at least 80%. Those that are going for IVF, IUI, prepare their body. People that have cases like cancer, diabetes, you name it, I work on them all. So that is what I do. So now I'm working on my Fertilemoms Coaching School for those that want to become fertility coaches like me. And while I'm in the hospital, I want to continue working. That's why my pad is here and my pen. So if you want to become a fertility coach, you can chat me up. Everything about me will be here. Chat me up on WhatsApp and Instagram. So please do not forget to subscribe, turn on post notifications to be seeing videos like this. I make videos every Sunday, sometimes every day. I'm posting videos depending on how many videos I have about motherhood, fertility, and all that. So we'll go back to our video again. I have my pair of slippers. I don't even know whether it's slippers. Slippers. This one is not the one that drops somebody on the thighs. It's rough at the back. I have my bathroom slippers. It's at the back. And then I have, you also have your charger, if you have touch light, phone charger, carry your phone charger. If you have rechargeable lamp, if you have touch light. Then I have 2 gowns that are open in front so that I can easily breastfeed, because and this is what I'll be wearing inside my camisole. Trouser on my, so I have 2 nightgowns. One of them, breastfeeding nightgowns. It has 2 buttons in front, and I can be able to very well. This one has a trouser. I really love this one, but I might not be wearing the trouser because of my CS wound, but I can wear the t-shirt. It's so beautiful. I love them. And then I have 2 bras here, breastfeeding bras. And then I have, see the other see my other disposable pants that I was looking for. I have a very big bowl here so that if I want to eat, they will not cheat me. They say when they do sales for you, don't eat for 24 hours. When they finally say I should eat there, they are camogo full here. I don't want to carry breakable plate. And then I carried one of my children's new bottles so that whatever liquid I want to pour here, I will not cheat myself. I will not cheat myself. And then I have a hot water flask. If you look at my other videos, I didn't used to have flask because I know that they'll say go home that day, but now I need it because you have to drink hot water, you have to take baby's bath. So that's why there's a flask here for hot water. So in my last video there was a seat bath bowl, there was breastfeeding pillow, but now I am doing CS. I might not be needing a seat bath bowl because I'm not going to be hurting in my vagina, even though I might have bleeding, but it's not going to cause pain. I will not have tear. I might not have, some people deliver and they start itching immediately. I might not have itching there because everything happened in my lower abdomen. So that's why there's no seat bath bowl here. But if you're going to deliver with your vagina, I would have still brought it. I didn't just remember. But please, if you watch my hospital backpacking of 4 years ago, I will make sure I link it down or up. You will see all those ones for normal delivery. And then breastfeeding pillow I didn't buy again. I still have, but I'm not even sure I might use it. So that's why. And then I have my bed sheet here. You know, in some hospitals like in Metama Hospital, they will not allow you to put your own bed sheet on the bed. But I doubt, because with my second child, I put my bed sheet on National Hospital's bed, but they didn't say anything. So I'm still carrying my bed sheet. That's not to say their own is not neat though, please. But I just feel comfortable, like I feel at home. It smells like my house, so I'll still feel at home. You know, staying out of your house for a few days, especially without your children, it's very hard. I know the only child I will be with, we'll be meeting ourselves for the first time. So what can we be saying to each other? We are strangers. So that is the end of our beautiful video, and I'll tell you guys why we chose elective CS this time and not vaginal delivery. And this, we don't have any complications, nothing. So I don't want to prolong the video, so that will be another beautiful video. So thank you guys, and I'll see you again. The next time you see me, you see me with a baby, because I'm already 38 weeks. I'm going to the hospital tomorrow. Today is 5th of August 2024, which is a Monday. And so tomorrow will be Tuesday, and I'm going on admission. In National Hospital, they say they do their CX surgeries on Thursdays. That's what the gynaecist told us. So you go for, we gave blood yesterday. They collected my blood for blood count. They checked my full blood sugar, and they collected blood for cross matching. Like, and the blood was plenty. They collected 5 bottles. Like, they go finish now we go say me I no get blood again. And then they said we should go and provide 2 pints of blood. But the last time I went for PCV, that's blood count volume, to check my blood volume, I had 32%, which was not excellent, but it wasn't bad. So I believe that by this time, if it's not up to 40 yet, I'll still be it will be good. It took some things to make it. I've been taking my iron supplements from the hospital, and then I took I made juice from time to time with beetroot. You know, beetroot promotes blood in the body, gives blood. And then this leaves, they call Jerusalem leaf. Hospital is too far. Very good for increasing blood volume. So I was taking them from time to time, and then I was mixing lemon inside. When you mix lemon, it helps the body absorb the iron very fast. So I believe that will give me a boost. So they say you go on the hospital bed tomorrow, they'll collect your results. The doctors will come and see you in the ward on Wednesday, review your results. The anesthesiologists will come and they will see you and look at the type of anesthesia they can give you. And then Thursday morning, it's your surgery day. So that's a very long process, but the Lord is our strength. So thank you all, and I'll see you guys when the baby is here. Peace out.